Vermont Senator and 2020 presidential candidate Bernie Sanders presented a bit of contradiction at a rally today, saying Americans deserve a choice in health care, but he wants to eliminate all private health insurance. Listen.
The American people are increasingly clear. They want a health care system that guarantees health care to all Americans as a right. They want a health care system which will lower health care costs and save them money.
Joining us right now is Indiana Senator Mike Braun, who is working on the GOP's own health care bill. So, Senator, tell us a little bit about your plan.
Well, you know, I know what Bernie's going to roll out. I think the price tag was like $32 trillion over 10 years. You know, that's not going to fly. That's jumping from the frying pan into the fire when it comes to health care. I've all along agreed that pre-existing conditions need to be covered. No cap on coverage. Kids can stay on the plan until they're 26. Those are good things. Obamacare, when it was crafted, the Affordable Care Act, which should have been called the opposite, was doomed to fail because you had big health care in cahoots with big government, never going to work. So what Bernie's talking about is, I think, closer to what most Americans expect until you say you're going to do it through government. And giving up private insurance across the board, it needs to be fixed. I think that would cause a riot out in the streets. Yeah. Most people are not ready for that. We need to hold the industry accountable, make them transparent, start fixing themselves. I tell them that all the time. And we need to, as Republicans, over the next year and a half or two, put a plan together that we sell to the American public. The ship has sailed when it comes to those three pillars. I created a plan in my own business 10 years ago that covered those factors. My employees have not had a premium increase in 9 years because I've embraced transparency. I've made my employees have skin in the game. They're taken care of when they get critically ill or have a bad accident, and it's sustainable, and I was able to lower family health care plans by $1,400 a year. We need to, as Republicans, start talking about that, and I think Americans will listen.
Senator, one of the things Republicans could do, I'm surprised they didn't do in the last election, is propose real liberalization of health savings accounts. Is that part of the agenda? How do you get the patient in charge instead of third-party factors like the insurance companies, Medicare, Medicaid, and large employers? How do you make it a consumer market again?
That definitely needs to be part of the plan. I did that again 10 years ago. I made it consumer-driven. Consumers in open, transparent, competitive markets, they do the heavy lifting. And there are more tools available now with technology and smartphones than ever before. It works in all other markets. Healthcare has evolved where you insure against the inevitable minor healthcare needs, scratches and dents. We've gotten away from employees, patients having skin in the game, and we've probably got a narrow window to get it all fixed because the industry itself has benefited from the status quo. That's why I tell them every day, you ought to be the ones worried mostly because you're going to have one business partner, the federal government. Many businesses are getting tired of putting up with the headaches. I just think it would be a shame. Yes.
I agree with you on all of these fronts, but I do think it's an issue when you're talking about transparency. We saw yesterday with the drug pricing hearing, nobody wants to take the blame. Nobody's willing to be transparent. So how are we going to enforce that, especially when you have the pharmaceutical industry lobbying Capitol Hill and spending millions?
You're going to have to do what I've done. I'm the only Republican out there that blames most of this crisis on the industry itself. Bernie Sanders, government getting involved in health care, is treating a symptom of a sick industry. And that's why I've got two or three transparency bills out there legislating that. You shouldn't have to do it. I would love to see the insurance companies, the drug companies, hospitals come up with their own transparency tools. And I think if we get the point across to them, they might do it because they're going to realize, like I said earlier, Medicare for all, is crazy. It's going to cost a lot, but we'll default in that direction, which is sad.
Senator, we only have about 30 seconds. I just got to ask you, Nancy Pelosi agrees with you that the plan, the Medicare for All, is unaffordable. It's going to cost $32 billion. What happens when the $32 trillion, excuse me, double the budget? What happens when they try to unite together when they have such different ideas about medicine? Quickly.
Well, they're going to try to do that. It's going to take folks like me that can articulate it with credibility, hold the industry accountable, get them working to save themselves, along with smart legislation that prods them to do it. We'll all regret the other alternative. We got plenty of time to articulate it.
Senator Mike Braun, great to see you, Senator. Thank you for coming. Good to hear the perspective of a businessman turned politician.